from the Aspergillosis Trust. I'm a patient. I personally have ABPA, bronchiectasis, and many related diseases. But thanks to the help of many medical specialists, I actually, been very active. So very good for that. And one of these people is Darius, and he's with me to talk about aspergillosis. Do you want to introduce yourself?
Yeah, thanks, Bart. That's very kind of you. So my name is Darius Armstrong James. I'm a reader in infectious diseases and medical mycology at Imperial College London, where I run a large research lab that's looking at Aspergillus fumigatus, aspergillosis. We do a lot of work on why people get these infections, as well as the organism itself and how we can treat it. In addition, I founded and co-lead the fungal disease service at the Royal Brompton with Anand Shah, where we have regular clinics, and I also look after the diagnostic side of things.
Perfect. And actually, this really goes to, if we follow the journey of a patient, and let's call the patient Bart.
Yeah, why not?
It took many years for Bart to get a diagnosis.
Yeah, that's a common refrain.
Yes, and so if we sort of deconstruct that a bit, then we would start with, why would we think that Bart has aspergillosis, as opposed to, like, assuming Bart has a lung problem, right? Goes to the GP, says, yeah, I'm not well. And why would it not be COPD? Why would it not be very bad asthma? Why would it not be lung cancer, and so forth? How would we deconstruct that? What would your recommendation be?
So it's a really interesting fundamental question, which you can address at many levels. Whether those are scientific or clinical, or in terms of how people see disease. I suppose that the word that we use in medicine is insidious, which basically means that many of these fungal infections are very slow. Apart from if you've got a very weakened immune system, in most people they take time to progress and to become detectable, either with tests or because the patient has typical signs. The other classic thing we see with Aspergillus is that it's what we call an opportunist, which means that it's not going to kill the average person who's walking down the street. It normally causes problems in people who've already got some kind of underlying disease that predisposes them to Aspergillus. And when we think about that, in general, there are two big groups. There's firstly the immunocompromised group, by which I mean people who've got weakened immune systems, either because they have HIV, or they've had a transplant, or they're having some kind of chemotherapy. And the other group is people with chronic respiratory disease, so people who've already got problems with their lungs, and in particular when they're being treated with steroids. And in that context, the treatments for the lung condition, as well as the weakness of the lungs immune system, can then allow them to get these infections. And the problem is that very often the symptoms that the Aspergillus is causing is very similar to the symptoms that the patient's experiencing from the underlying disease they have. So the only way that the penny is likely to drop in terms of making the diagnosis of Aspergillus is either when the disease worsens and becomes refractory or non-responsive to treatment, or when someone does some form of scan that then picks up some of the features that we associate with Aspergillus.
So to be clear, Darius, I think you're also saying that aspergillosis cannot normally be diagnosed by a GP. Would you agree with that statement?
I think that's correct. I think that the only way that it would be diagnosed by a GP is if they were sending off a sputum culture and they grew Aspergillus, or if a GP had requested a chest X-ray and that showed something like what we call an aspergilloma or mycetoma, which is a fungal ball within a cavity in the lung. But in terms of the blood tests that we do for Aspergillus, those are not tests that GPs would commonly request or have much experience of.
Right. So as a potential patient, like, firstly, of course, to be clear, most patients do not know what aspergillosis is. Right.
Despite the fact that it's actually a relatively common disease, right?
I was going to get to that, but
Yeah.
let's stay back. Like, when I was diagnosed in that London Bridge.
Yes.
I had to look it up on Wikipedia.
Yeah.
I had no idea what this was. So But what is the lowest threshold that we can help a GP? Would we then say, "Oh, something's wrong. Please do a cultivation or a
Yeah.
scan"? What would you recommend?
Well, I think broadly that it's a very interesting issue. That's obviously always very important for patients. We have a broad issue in the UK and globally that fungal diseases are not well recognised, and so fundamentally, I think what this comes down to is exactly what we're doing here and now, which is advocacy. You know, it's basically raising the profile, educating people, you know, getting the information out there about this condition. And I mean, like you, I've given this quite a lot of thought in my career. I think the problem is that because it's this opportunistic type of infection, it's not affecting people as they walk down the street. And so there's not the same kind of fear factor of something like, I don't know, Ebola or TB or flu that anyone can catch. It's only certain populations that can get it. But in terms of the GP, I would have thought that, you know, you can point them in the direction of information or request. You know, it's perfectly within the remit of a patient to request referral to a specialist who's got expertise in the condition. For instance, at the moment, we're doing a huge amount of work trying to access electronic health care records across the region, so we can identify people who've got Aspergillus, who haven't been, you know, sent to specialist centres, and you know may not be receiving, you know, highly specialised care. So I would hope, you know, with the work that the Aspergillosis Trust is doing around patient information sheets and websites and things, that can be a really helpful resource that enables patients to provide appropriate information for their general practitioners.
Yeah, I wanted to pick up on something you said earlier.
Yeah.
Again, when I was diagnosed, my view was, I never heard about this, and I don't know anybody who has aspergillosis.
Yeah.
Now, that second statement might not necessarily be true, right?
It might not, and those people might not even know that they have it, as you've alluded to.
Yeah. Can you talk a bit more about that?
So I think it's incredibly, you know, complex area, but in essence, for me as a sort of scientific kind of minded person, fundamentally, you know, this is about defining Aspergillus infection. And what's interesting is that there's actually a spectrum of disease. So, of course, you know, some people may have very severe allergic bronchopulmonary aspergillosis or chronic pulmonary aspergillosis or invasive aspergillosis. But there's a whole other group of people who have what we call either sensitization to Aspergillus or colonization with the fungus.
Yeah.
And it depends how you set the case definitions for those conditions as to how many people you might think of it. Might think have them. For instance, I mean, there was a study done by colleagues in Oxford where they did PCR to look at how many patients with asthma or COPD had Aspergillus colonization, and about 50% of them did. So actually, if we're purely talking about whether or not people have got Aspergillus growing inside their lungs, then, you know, very many people with chronic respiratory diseases will have Aspergillus in their lungs. But it's only when it gets to a certain sort of level of infection or immune sensitization that they then develop things like ABPA. So actually, there are probably a lot more people who don't know they have Aspergillus in some form than do know.
Yeah. So I think for our first episode, like what you're really saying is it's opportunistic and it's gradual.
Yeah.
It's very hard to see, and indeed that's why it often gets missed. But
Yeah.
if you see, and it normally occurs, not always, with people who have prior lung conditions. I think in particular the ones that I heard of is asthma and cystic fibrosis.
Asthma and cystic fibrosis, those are typical for ABPA, but for chronic pulmonary aspergillosis, then we think of people with COPD, TB, and also at the Brompton in particular, we have a lot of sarcoidosis patients who have secondary chronic pulmonary aspergillosis. So effectively, those are all group of people who have structural damage in their lungs with cavities.
Yeah. But and then the final learning from our first episode is that GP cannot necessarily diagnose it, doesn't have the right tools.
Correct.
So if you feel a important change in your pulmonary system, in your it would be good to ask for a referral to a pulmonary specialist, to get a X-ray done, to get a specialized blood test done. I would also say, from my personal experience again, while you're not diagnosed, you don't get better.
Correct. Yeah.
And so, for instance, bronchiectasis can create a lot of damage, and so the sooner you get diagnosed, the better. So it is quite important.
That's absolutely true. We want to control the fungus because it is causing the bronchiectasis in 90% of cases.
Yeah, and also for people in the UK, there's a lot of thought given, rightly so, to value for money for the NHS, and in cases like these, in chronic diseases, a early diagnosis will really be very cost effective for the NHS, as well as beneficial for the patient.
I completely agree with you. I think that is, common sense. We'd love to produce the data to show it, and we are trying to do some economic analyses around that. Most of the economic data around diagnosis and treatment of Aspergillus actually is in invasive Aspergillus, but it would be very good to generate that kind of data, and it'd be extremely useful for advocacy in terms of getting the attention of the NHS to have that kind of information.
Fantastic. I think this ends our first episode of our discussion with Darius, where we sort of focused on how do we get to a diagnosis. I think in the next episode, I would like to talk about a bit more understanding of what is actually aspergillosis, and then what's the journey of the patients beyond this diagnosis. So stay tuned for our next recording. Thank you very much.
Thank you very much, Bart, and everyone.